John, you know, if there's a trade-off between having to travel further or having a safe service, you know, there is an argument certainly for having the safest service there can be. And this time last year, HICWA said that the intensive care unit in Portlaoise still does not meet the minimum requirements for critical care. Surely it would be irresponsible to ignore that.
No, it's not, because the hospital and the A&E has been consistently underfunded, and that's actually the problem. If you see what has happened between the link-up between our maternity ward and the COOM, where we're under the governance of the COOM, that has actually worked absolutely fine. Our A&E is working perfectly. We are one of the busier hospitals in the region, and yet our budget is 51 million. Compare that with Kilkenny, which has a smaller catchment area, 74 million. Compare that with Tullamore. We're busier than Tullamore, and they have a budget of 96 million. So if you consistently underfund the service, yes, and the argument also is it's great if you get inside a shiny new hospital, you get treatment. There's no shiny new hospital out there. Tala, you can't get into the car park, never mind get into the A&E. And it's 2 hours up the road at best. And what you will have is you will have patients not turning up, not going in simply because it's too far. And that's going to be a problem as well. So this idea of patient safety is a nonsense. This is about budgets. This is about where money is spent and where consultants are having their private patients and their public patients mix. That's really what it's about.
John, we saw in Robert Short's report the protests on the streets of Portlaoise over the weekend. We heard from Michael about similar protests in Ennis. Now, at the moment, you have a cabinet minister as a local TD who's supporting your cause. You won't always have a cabinet minister. At that point, does it become politically impossible to retain the service?
It shouldn't become politically impossible to retain the service. The bottom line is what the HSE is proposing is absolutely wrong. The report is fundamentally flawed in its construction from the start. And ultimately, yes, this will be a political decision. But thankfully, we live in a country that's a democracy. We do not live in a city. If this was Manchester or Birmingham and everybody was an hour on a nice motorway from an A&E, great stuff. But we don't. We live in a country. And we're still a democratic country the last time I checked. And it is a message also to our politicians. They have to deliver for people. And we're not going to follow down the same road, and we're not going to be codded, as one of your other speakers have said. We can see what's happening. The people in this country are fed up with our post offices being closed down, our banks being closed down, our Garda stations being taken away, and are not now going to take away our healthcare on this spurious argument that people will be safer. You are not safer if you are transferred into a hospital that is already overcrowded, that 4 weeks ago didn't have a consultant on call. You can't get into the car parks and you're going to be left on a trolley. The mortality rates on trolleys are higher than the mortality rates in hospital beds. We have a fully functioning hospital. We intend to keep a fully functioning hospital.
OK. John Hanniffy, I'm sure it's a story we'll come back to, but thank you for joining us. Thanks also to Peadar McMahon, Katrina McGoldrick and Michael Kilfoyle. Thank you all very much.